These new members worked really hard, and we're so proud of them that they, in fact, been elected. We want to show them the respect as I introduce this new class of 2030. So I just want to first say that it's just wonderful to see you enjoying yourself. It's very clear. And I thank you for coming to my little party. It's great to have you here. I do like to acknowledge the council members and ask them to stand for those who are present. Please stand, the council members. I won't read their names. Please, thank you. I want to thank them for all that they do, particularly give me great counsel, wisdom, and input on behalf of this organization. Thank you. I also like to acknowledge the presence of the past presidents of the IOM who are here tonight. If they can stand to Harvey Feinberg. Harvey, where are you? Thank you. Yeah. Ken Shine. Ken. And Sam Thier. Sam. Earlier today, I saw David Hamburg here, but I believe he's not present tonight. But I also want to thank him and so many others, the past presidents, for building this great foundation of this wonderful organization. So one more time, please help me in recognizing them. Thank you. I would also like to acknowledge the membership committee. You know, members are the foundation of this organization, and the membership committee works so hard to be sure that we, in fact, select the right people who's driving this organization forward. So I'd like to thank Leighton Chen, the chairman. Leighton. Thank you. And Jane Hinney, of course, the Home Secretary. Jane. Thank you, Jane. And of course, all the committee members who are here, please stand and let me acknowledge you. Thank you. And of course, I'd like to thank our staff who really keep this process running. You can see how complex this is. And of course, the staff of our council and the membership office. Judith Shamir. Judith. Donna Duncan. Donna, thank you. Jamal Samuel and Zimika Stewart. Thank you for both of you. And now, it is my great privilege to introduce the class of 2013. And I would have the privilege not only of introducing them, but also have a chance to tell you a little bit about them through their citation and tribute. So I ask you to pay close attention, because there will be a question afterwards, so you can remember every one of them. Also, at the end of each, I would ask each member to come up so we can acknowledge you, both in terms of presenting you to the people here, as well as a certificate that recognizes your membership. So it's my great pleasure to begin first with introducing Janice Epkowitz, a leader in academic hematology. Janice Epkowitz has described hematopoietic stem cell replication rate and fate decisions in vivo, demonstrated how heme trafficking regulates red cell differentiation and systemic iron hemostasis, and define cellular and molecular mechanisms of erythroid marrow failure. As a president of American Society of Hematology, she initiated a bridge grant that made it possible for dozens of hematology researchers to continue work. Janice, congratulations and welcome. Next is Katrina Armstrong. Katrina Armstrong has illuminated the role of genomic technologies in cancer control and outcomes, and has uncovered racial disparities in genetic testing and risk communication. She identified novel causes of cancer disparities and approaches to personalized breast cancer reduction, ultimately advancing observational and decision sciences in cancer research, and contributing to improved cure for the vulnerable population. Katrina, congratulations and welcome. Next is Subrahmanyan Arukumaran. Subrahmanyan Arukumaran has improved the quality of life for women and babies through his research of intrapartum surveillance, management of labor complications, and surgical management of postpartum hemorrhage. He has contributed policies that have improved safety and quality of care in pregnancy and labor in the National Health Services in UK. As president of the British Medical Association and the International Federation of Gynecology Obstetrics, he extends his activities and advocacy to a national and global stage. Welcome, Aru. Diana Bianchi. Diana Bianchi has advanced non-invasive methods to assess human fetal development, paving the way for improving DNA diagnosis and fetal therapies. Utilizing creative techniques for the isolation and analysis of fetal cells and nucleic acid in maternal plasma, she has provided insights into maternal fetal physiology and reproductive genomics that have translated clinically into screening and diagnosis of human genetic disorders. Diana, congratulations and welcome. Jeffrey Bluestone. Jeffrey Bluestone's unique meld of basic and translation research has contributed to the unraveling and fundamental processes of immune tolerance and to the development of drugs to treat organ transplantation rejection, cancer, and autoimmune disease. A leader in research, entrepreneurship, partnership building, he created the Immune Tolerance Network and the UCSF Diabetes Center and leads the academic enterprise at UCSF. Congratulations, welcome, Jeff. Charles L. Bosk. Charles Bosk, a medical sociologist, ethnographer, and bioethicist, importantly influenced the understanding of residency supervision, hospital safety, and empirical bioethics. His book on surgical training and his innovative work with Peter Pronovost and others explicating the cultural systems underlying checklists contribute to the driving of our health system to safer care delivery. Congratulations and welcome, Charles. Mary Bartlett Bunge. Mary Bunge elucidated the structure and function of cells that form myelin and reveal interactions between Schwann cells, neurons, and fibroblasts. Her work has allowed development of a spinal cord injury model that relies on reparative Schwann cell transplantation and is now in phase 1 trial. Congratulations and welcome, Mary. Thank you. Molly Cook, an eminent international figure in health profession education, Molly Cook has led research and education program development that constitute a transformative agenda, incorporated insights from the learning sciences and grounded in a deep knowledge of policy and health service delivery. Her Carnegie report is referred as, quote, the second Flexner report, and her work in resource-poor and rich and poor areas is preparing health professionals across the globe to better respond to the needs of the population. Molly, congratulations and welcome. Delo's Toby Cosgrove, the third. Toby Cosgrove has implemented programs and initiatives that have enhanced patient focus, accountability, and teamwork across the Cleveland Clinic system, creating a culture of collaboration and clinical excellence. He has mandated quality and outcomes reporting, replaced divisions of surgery and medicine with patient-centered institutes, and he has transformed the treatment of mitral valve disease, performed the world's first minimally invasive aortic valve surgery, has patented 30 clinical devices and procedures. Toby, welcome and congratulations. Patrick Hoover, an engineer of new drug delivery system. Patrick Hoover has pioneered studies of cancer nanomedicine and pharmaceutical nanotechnology, discovering that nanotechnology may be used to deliver drugs intracellularly and reporting that insulin may be administered orally with nanocapsules. He has prepared and commercialized targeted nanosystems for cancer treatment, including doxorubicin, loaded nanoparticles for treatment of resistant hepatocarcinoma. Patrick, congratulations and welcome. Mary Dalton, a leader of NICHD-sponsored FASTER trial. Mary Dalton contributed to the changing screening recommendation for all pregnant women in UK and US, initiated careers for many young investigators, and drove the creation of national programs for education and quality monitoring in diagnostic ultrasound. She is currently working on national and state initiatives to reduce maternal mortality, and her work has led to the exponential growth in the field of maternal and fetal health. Congratulations and welcome, Mary. Ara Darzi. Ara Darzi has made major contributions to health and medicine, encompassing surgical care, education, research, technology, innovation, and administration, and has pioneered work in minimally invasive surgery. He brings this varied experience to shape policy at the very highest level in the UK government, where, to quote Lancet, and I quote, he has thrown out regulation as the organizing principle of NHS and replaced it with quality, end of quote. Ara, congratulations and welcome. Carlos de Rio. Carlos de Rio's research has enhanced access to diagnosis and care for HIV-infected underserved populations in the US and throughout the world. His work on routine HIV testing, linkage to care, and the care cascade have been the basis of IOM recommendations and have led to new HIV prevention initiatives. and change public health policies altogether. Congratulations and welcome, Carlos. David Demetz. David Demetz is a leading figure in biostatistics and biomedical informatics, and his paper on interim analysis, role of data monitoring committees, and surrogate endpoints are landmarks in establishing biostatistical features of randomized clinical trials. He is a leader of many academic institutions and professional organizations, and a tireless advocate for the expansion of training programs to establish the next generation of biostatistical leaders. Welcome and congratulations, David. Phyllis A. Dannery. Phyllis Dannery is a physician scientist who has elucidated novel mechanisms dictating tolerance against debilitating neonatal lung injury or bronchopulmonary dysplasia. As a national, international, and institutional leader, she oversees one of the largest divisions of neonatology and is committed to addressing the problems of prematurity, infant mortality, and health disparities. Phyllis, congratulations and welcome. Jeffrey A. Dribbin. Jeffrey Dribbin's career has focused on improving the treatment of patients with cancer, and his basic translational research has laid the groundwork for the development of targeted therapies for breast cancer. He's a leader across disciplines and institutions, bringing people together to improve surgical management of cancer. Congratulations and welcome, Jeffrey. Daming Fang. Daming Fang is one of the most influential leaders in health policy and biomedical sciences in China. And as Vice President of Chinese Academy of Engineering, he has greatly enhanced international collaboration and improved healthcare in underserved areas. A physician scientist and leader in medical research education, he's made monumental contributions to gastrointestinal cancer diagnosis and understanding of cancer metastases. Daming, congratulations and welcome. Eric Furon. Eric Furon is a leader in cancer research whose work provides seminal insights into the role of oncogene and tumor suppressor gene defects in colon tumor growth, spurring efforts to detect mutations and understand their relationship to colorectal cancer prognosis. He dissected the contribution of beta-catenin dysregulation and CDX2 transcription factor defects in tumorigenesis, and developed novel mouse models of colorectal cancer. Congratulations and welcome, Eric. Mark Friese. Mark Friese has created key insights at the intersection of biomedical informatics and health economics, particularly in relation to sharing of clinical data. His work moves beyond the relationship, beyond theory, and bridges academia industry to tackle rising costs of medical care while maintaining its quality. Please congratulate and welcome Mark Friese. Judy Garber. Judy Garber is a leader in clinical cancer genetics, making major contributions in the recognition of hereditary cancer predisposition syndromes and their management, including risk assessment, psychological burdens, screening, chemoprevention, and therapeutic strategies. Her work and leadership positions have greatly expanded the field and influenced policy on a national basis. Judy, congratulations and welcome. Ronald Germain. Ronald Germain's far-reaching contributions to the field of immunology include fundamental molecular discoveries to integration of omic technologies, leading high-resolution, quantitative in vivo studies of the immune system. He was the first to establish a dedicated, robust systems biology program within the NIH intramural research program. Congratulations and welcome, Ronald. Eileen Geronimus. Eileen Geronimus is a leading researcher on health disparities and originated the weathering hypothesis, which posits that early cardiovascular and reproductive health deterioration among African American women is due in part to their lifelong exposure to highly stressful physical and social environments. Her commitment to understanding disparities spans multiple levels, as illustrated by her work to test whether weathering conditions affect telomere length in women. Congratulations and welcome, Arlene. Karen Glantz. Bridging the fields of public health and social sciences, Karen Glantz has developed interventions to improve health behaviors and environments, tested and disseminated multi-level cancer prevention strategies, and refined measurement methods. She was an early researcher of nutritional environment, beginning her work before today's obesity epidemic emerged. So, Karen, congratulations and welcome. Joseph Gleason. Joseph Gleason is a pioneer in functional genomics of neurologic and psychiatric disorders, and who has developed groundbreaking clinical, genetic, and treatment resources for the study of neurodevelopment disorders that range from autism to epilepsy. He's traveled the world to personally evaluate thousands of families suffering from elusive neurologic and psychiatric diseases and identified 20 new genetic syndromes and causes of disease. Congratulations and welcome, Joseph. Susan Hasmiller. Susan Hassmiller is an international leader in nursing, primary care, and health professions education, has developed and led major nursing, physician, and interprofessional education innovations, in part through state and national coalition building. She has been a key Red Cross volunteer leader in national and international disaster program innovation, policy, and oversight in preparedness and response. Congratulations and welcome, Susan. Mauricio Hernandez Avila. Mauricio Hernandez Avila is a leader in public health in Americas, directing Mexico's Institute of Public Health, leading prevention and health promotion initiatives, leading efforts to address the H1N1 and obesity epidemics, tobacco use, and infectious disease. His contribution as a researcher have influenced public policy around tobacco, obesity control. Congratulations, welcome, Mauricio. Jody Hyman, a scholar in global social policy. Jody Hyman built the first global initiative to examine health and social policy in all 193 UN nations, affecting people's ability to meet their health and well-being needs. She founded Global Working Families Initiative, the first program to examine the experience of working families in all continents, and has led seminal studies on HIV and tuberculosis policy and has transformed the data available to policymakers and researchers. Jody, congratulations and welcome. Wan Hong. Wan Hong is a medical oncologist and a leading authority on lung and head and neck cancers, who advanced the treatment of laryngeal cancer by using chemoradiation to avoid removing the voice box, and demonstrated the efficacy and safety of retinoids in oral carcinogenesis. He's opened up the field of personalized targeted therapy through the groundbreaking BETTLE trial, and his work will greatly contribute to more patient-centered and less intrusive approaches to cancer care. Congratulations and welcome, Huang. Brian Jack. Brian Jack is a researcher and leader of hospital discharge reengineering, whose technology-assisted systems are disseminated nationally and internationally to enhance safety and improve patient outcomes. He led the CDC's effort to define the clinical content of preconception care, is investigating the impact of behavioral health and family caregiving interventions on readmission, and brings his expertise globally to improve quality of services in Lesotho, Albania, Jordan, Romania, and Vietnam. Congratulations, welcome, Brian. Clifford R. Jack Jr. Clifford Jack pioneered the use of quantitative MRI in epilepsy and Alzheimer's disease. These methods have been adopted worldwide, and his research group serves as a central MRI lab for a number of national and international observational and therapeutic studies. His model for the pathogenesis of Alzheimer's, which integrates imaging and biomarkers, have greatly influenced the direction of research in the field. Congratulations and welcome, Clifford. Carlos Ahan. Carlos Ahan is a leader in studying and building high-performance primary care practices, patient-centered medical homes, mixed method evaluation of healthcare transformation, and tobacco cessation and control interventions. His commitment to primary care workforce development and reducing disparities among Latino population will be felt in underserved population in the U.S., Latin America, and beyond. Congratulations, Carlos, and welcome. Alan Jetty. Alan Jetty's work in the field of disability research, particularly in the conceptualization, measurement, and epidemiology of disability, has transformed how disability is understood. The translation of his work into healthcare improvement and public health policy has impacted millions of people as the first physical therapist to be elected to the IOM. Congratulations, Alan. Ashish K. Dzau, a scholar on quality of care. Ashish has provided the empirical basis for key public initiatives related to quality, health IT, public reporting, and pay for performance. Through his research and close work with government officials and the Department of Veterans Affairs, he directly influences the policy that impacts care across the nation. Congratulations and welcome, Ashish. Evan Kurish. Through his mechanistic and clinical pharmacology research, Evan Kurish described the metabolic, pharmacogenetic, and drug interaction basis for inter-individual variability and analgesic disposition and response, enabling personalized analgesic pharmacology. His work has led to the clinical approval of sevoflurane, the most widely used anesthetic that has changed national standards and improved patient safety, and ultimately is leading to safer and more effective pain management and therapies. Congratulations, welcome, Evan. Anna Kurth, a midwife, nurse epidemiologist, and a scientist. Anna Kurth acts on her commitment to social justice by investing in extremely poor African nations, especially in nurse workforce development. She co-led Rwanda's human resource for health programs to rebuild the national health workforce in the post-genocide era and initiated efforts to preserve the health of Ghana nurse leaders. And congratulations and welcome. Nancy Lane, a leader in women's health issues. Nancy Lane had made seminal contributions in understanding the epidemiology and genetic contributions to knee and hip osteoarthritis and introduced innovative therapies in osteoarthritis and osteoporosis. She is dedicated to mentoring and building a cadre of young investigators and illustrates this through her leadership in a national effort to train junior faculty in securing funding to study musculoskeletal diseases. Congratulations and welcome, Nancy. Anne Lode. Anne Lode is a master scholar of French, European, and comparative health law who works at the intersection of science, law, and public policy on issues of critical interest on both sides of the Atlantic. Her work on patients' rights, physician-patient relationship, medical practice evaluation, and health data sharing has been incorporated into national legislation. Congratulations and welcome, Anne. Thomas A. Leviste. Thomas A. Leviste is an internationally recognized leader in empirical examination of the role of segregation in health and healthcare, and his conceptual work and innovative empirical analysis have transformed our understanding of the joint contribution of race and socioeconomic status to health. He was the first person to quantify the direct and indirect economic costs of racial and ethnic health disparities, information that's desperately needed to address worsening disparities within countries. Congratulations and welcome, Thomas. Quinn Lee. Quinn Lee has identified and validated several biomarkers of hypoxia and prognosis, including osteopontin and galectin-1 in head and neck and lung cancers. And she has developed new approaches to improving salivary gland function after radiation damage. She has led large multi-center clinical trials to test the delivery of novel therapies with chemoradiation in head and neck and lung cancers, has changed the worldwide cancer treatment standards. Congratulations, welcome, Quinn. Brandon Lee. Brandon Lee has made seminal contributions in medical genetics, pediatrics, and physician scientist development, including definitive molecular genetic observations and mechanistic studies on human skeletal dysplasias and urea cycle disorders. In addition to his basic and translational research, he continues to care for skeletal and metabolic patients and is committed to training future leaders in the field. Congratulations and welcome, Brandon. Warren Leonard. Warren Leonard has made outstanding contributions to molecular immunology, revealing mechanisms and causes of severe combined immunodeficiency, discovering and cloning several receptors, and elucidating the mechanism and biology of TSLP and gamma-L-C family cytokines. His contribution has led to novel diagnostics and therapeutics for immunodeficiency, autoimmune, allergy, and leukemia. Congratulations and welcome, Warren. Pat Levitt, a pioneer in molecular approaches to understanding brain development and mental illness. Pat Levitt discovered risk genes for autism, identified a role for brain GIT and brain placental interactions in development of neuropsychiatric disorders, was the first to perform gene expression studies in schizophrenia. It brings his science to business and policy leaders, and works tirelessly with policymakers to improve brain and child development outcomes for those at-risk children. Congratulations and welcome, Pat. By the way, Pat's entire family is the table 6. Beverly Malone, as CEO of the National League for Nursing, Beverly Malone is one of the leading voices in our nation's ongoing quest for best standards and practice in today's complex, dynamic health environment. She's an educator, an innovator, a leader in the creation of strong and diverse nursing workforce globally, and is committed to improving access to care for the poor, elderly, and the veterans. Congratulations and welcome, Beverly. Jonah Massett. Through epidemiology, scientific leadership, and academic innovation, Jonah Massett has improved global health, pandemic preparedness, and disease intervention by demonstrating that rigorous health science and discovery are critical to successful responses. She's a service-oriented veterinarian epidemiologist who's committed to transdisciplinary problem-solving and convenes desperate groups from all fields to build networks for science-based health policy and surveillance. Congratulations and welcome, Jonah. Ruslan Metsinov. Did I get it right? Close. Ruslan Metsinov, a leader in immunology. Ruslan Metsinov discovered toll-like receptors as the key innate immune receptors that detect pathogens and link innate recognition to the activation of adaptive immunity. He has propelled the study of recognition receptors into other areas, including inflammatory origin of cancer, discovery of new cytosolic DNA sensing pathways, and strategies for effective vaccination. Congratulations and welcome, Ruslan. Bernadette Melnick, an expert in transdisciplinary interventional research and advocate of evidence-based practice. Bernadette Melnick has led major national and global efforts to improve healthcare quality and safety. Her work has focused on the integration of mental health into primary care settings, interprofessional education and practice, and the improvement of children's health outcomes through research, advocacy, and school-based and primary care interventions. Congratulations, Bernadette, and welcome. David Mooney, a pioneer in bioengineering and regenerative medicine. David Mooney invented technologies to control angiogenesis, stabilize blood vessels for tissue regeneration, and made seminal contributions to drug delivery and mechanical transduction. He created polymers that mimic infection and induced melanoma regression, work that led to a clinical trial of a cancer vaccine, and illustrates his dedication in moving therapies from the lab to the clinic. Congratulations, David, and welcome. Luis Mulia. Through his work on reproductive physiology and genetics, Luis Mulia has pioneered our understanding of endocrine regulation, of the mechanisms controlling the timing of human birth, revealing insights into the biology of parturition, and ultimately contributing to the prevention of preterm birth. He's an innovator in health profession education in the area of preterm birth, and his efforts to integrate multiple specialties are fostering a new transdisciplinary team science. Congratulations, welcome, Louis. Joan O'Brien. Joan O'Brien has a wide-ranging career as a scientist investigating genetics of eye disease, a physician specializing in the treatment of ocular tumors, and a pioneer in researching the genetics of primary open-angle glaucoma in African Americans. She's known for her excellence in teaching and has initiated interdisciplinary programs serving as a role model for clinician scientists. Congratulations and welcome, Joan. Francis Omaswa. Francis Omaswa is one of the world's preeminent global health statesmen and Africa's leading architect of health science education to improve health systems strengthening. He's made major contributions to health in Uganda and globally through his work spanning cardiac surgery, policy, and health diplomacy, education, and executive management. Congratulations and welcome, Francis. You know, it's wonderful to know so many people. Francis' family is here, and I know so many other people are here, so I want to make sure I remember to congratulate the families at the end. Yes, we should do it now. Daniel Pine was among the first to link childhood anxiety to adult psychopathology, and to show that treating pediatric anxiety could be a pathway for prevention. He has led the way for applying functional imaging and cognitive neuroscience research to pediatric anxiety, identifying alterations associated with anxious temperaments and disorders, and establishing a new paradigm for child psychiatry research. Congratulations and welcome, Daniel. Helen Pinnacle Worms. Helen Pinnacle Worms illuminated many fundamental tenets of cell cycle control, elucidating how key mitotic regulators CDK1 functions in normal cell cycle and in the setting of damaged DNA. Her identification of checkpoint kinase as a target of anti-cancer agent UCN01 led to novel therapeutic regimens targeting p53 deficient tumors. Congratulations and welcome, Helen. Bruce Satie. Bruce Satie is a pharmacoepidemiologist and a major advocate for scientifically based drug safety and FDA policy, and his use of meta-analytic methods to assess the reliability of genetic association is a major innovation in research. He has shaped the understanding of prevention and treatment of cardiovascular disease through its research on the effects of various drugs on cardiovascular outcomes, potential of using drug-gene interaction to improve outcomes, and the discovery of genetic variants associated with many cardiovascular and aging phenotypes. Congratulations and welcome, Bruce. Evan Sadler. Evan Sadler pioneered the work of a number of blood coagulation factors, and his work had led to major improvement in diagnosis and therapy for bleeding disorders. His contributions were critical to the molecular genetic and biochemical characterization on von Willebrand's factor and Adam TS13, and development of diagnostic guidelines to treatment of von Willebrand's disease and thrombotic thrombocytopenia. Congratulations and welcome, Evan. Yoel Sadovsky, a researcher on the role of placenta in fetal growth. Yoel Sadovsky discovered mechanisms underlying placental differentiation and adaptation to injury, uncovered functions of microRNA in placental trophoblasts, and illuminated central pathways in placenta fat trafficking. As director of the Maggie Women's Research Institute, he's a leader of women's and reproductive health initiatives and advocate for education around the biology of diseases that affect women, and a mentor to many who research women's health. Congratulations and welcome, Yoel. Mark Schuster. Mark conducts research on child, adolescent, and family health and has led key studies related to health disparities, paid family leave for parents of chronically ill children, adolescent sexual health, worksite health promotion, and pediatric quality measures. His work has led to major policy and service changes. For example, his research on obesity prevention prompted a California law requiring drinking water to be available in all school cafeterias. Congratulations, welcome, Mark. Narif Shah. During his leadership of the New York State Health Department, Narif Shah implemented Medicaid reforms that resulted in savings of $4 billion in the first year while improving quality and spearheading one of the most successful health exchanges in the nation. He's a major proponent of health innovation and data transparency and established New York as the first state in the nation to liberate its health data. Congratulations and welcome, Narif. George Shaw. George Shaw and colleagues first cloned the HIV-1 genome and demonstrated its genetic diversity in vivo and developed the first recombinant DNA-based assays for detecting HIV-1 antibodies and nucleic acids in human placenta and plasma. Shaw discovered a novel strategy for identifying and characterizing transmitted HIV-1 genome, and his work bridging clinical medicine and basic virology research had led to important advances in HIV and HCV diagnosis and therapeutics. Congratulations and welcome, George. Lisa Thompson, blending her expertise in healthcare research and her capacity to communicate how health policies can be informed by research, Lisa Simpson has contributed our understanding of disparities and the quality of care and to policy around childhood obesity. She has applied her findings to enhancing the Children's Health Insurance Program and commits truly multidisciplinary and team skills to improving national policy in health and practice altogether. Congratulations, welcome, Lisa. Pamela Sklar. Pamela Sklar pioneered large-scale genomic studies of schizophrenia and bipolar disorder and produced the first statistically convincing identification of gene risk factors for psychiatric diseases. These studies have provided fundamental insights into genetic architecture and the etiology of mental illness and are prompting re-evaluation of the classification of disease in the field. Congratulations and welcome, Pamela. Matthew State. Matthew State is a pioneer in identifying mutations that substantially contribute to risk for autism, the Dzau de la Tourette syndrome, and other neurological developmental syndromes, and of particular note is his discovery of replicable rare de novo mutation contributing to autism risk. Through his many leadership and advisory roles, he brings his science to public discourse and generates national attention to childhood psychiatric disorders. Congratulations and welcome, Matthew. George Stengel. George Stengel has made major contributions to our understanding of skin immunology, including the identification of Langerhans cells as targets of HIV-1 and mechanisms of action genetically modified cancer cell-based vaccines. He has trained many fellows and has contributed to organizational science in Austria and throughout the world through his role at the Austrian Academy of Sciences as secretary since 2003. Congratulations, welcome, George. Subra Sarish. Subra Sarish has contributed our understanding of the role of cell mechanics in influencing human infectious disease and cancer, and has illuminated how malaria parasites and specific proteins transported to the host alter cell deformity, biorheology, and cytoadherence. A member of all three academies of National Academy, he's a leader in promoting science and engineering education and research, and is dedicated to assuring that all people benefit from our scientific advances. And I know Subra's family is also here. Congratulations and welcome, Subra. Christopher Walsh. Christopher Walsh bench-to-bedside approach of finding families with epilepsy and then identifying responsible gene mutation has made him a leading expert on genetically inherited disease of the formation of the cerebral cortex. He has discovered more than 24 genes that, when mutated, produce pediatric brain disorders, shedding much light on the inherited developmental conditions such as epilepsy, intellectual disability, and autism. Congratulations and welcome, Christopher. Betsy Weiner. Since 1980s, Betsy Weiner has led the way for innovative technology-based education and simulation for the health professionals, from academic programs to disaster response training for 2.5 million health professionals worldwide. She has skillfully matched evolving technology with pressing topics, and her labor and delivery computer simulations used by 98% of nursing programs in the U.S. Congratulations and welcome, Betsy. And the end is in sight. Last but not the least, James Williscroft. James Williscroft is a pioneer in assessment of medical education, especially in ambulatory sites, and of student attitudes and learners' skill across a range of competencies. As a dean, he leads local and international medical education initiatives, is a mentor for research-focused medical educators, and is increasing accessibility to medical education internationally through his Open Education Resource Initiative. James, congratulations and welcome. Thank you. Well, what do you think? Yeah. Now, just be sure, I hope I didn't miss anybody who's a class of 2013 that I didn't mention the name. Anyone? Great. Now, you can see, there was a lot of reading, and you listened intently, right? But I think you can see the quality, the excellence of the new members. And we're so proud of them. And we're so glad they're now part of the family. So one more round of applause for them. Well, I told everybody I'm in my first 100 days. I'm still in my honeymoon. And let's face it, what a great evening tonight is. And when I look at all the great chemistry, everybody in this room, it just makes me feel so good to be part of this great family. And thank you for your attention. I want to make sure that you know that for the members, we see you tomorrow. For the families, you can go out and celebrate. But there's more work to be done. So just want to be sure that there are buses waiting for you on the 21st Street side, I think it's over here, this way, I believe, to take you back to Melrose Hotel. And then there'll be shuttle bus tomorrow morning, beginning at 6:45, no, not 7, 6:45 a.m. And breakfast will be provided here in the tent. And of course, we're going to have my lecture, my remarks on an IOM in transition, seizing the opportunity to shape the future. Thank you so much for being here tonight.